Welcome to a Wonder Junkie podcast. I'm your host, Ryan Anderson. If you enjoy this episode, please rate the show and share it on iTunes, Spotify, YouTube, and Rumble. That helps people to discover the show. Enjoy the episode.
Nobody knows what's going on. Nobody knows. Nobody has the faintest idea. The best guesses are lies. You may be sure of it.
All right, Dr. Klessig, thank you so much for joining me this morning.
Thank you so much for having me, Ryan. This is truly a pleasure.
Yes, thank you. I know it takes a lot of courage to do what you've been doing, and I stumbled upon this subject of what you've been writing books about, speaking about, and I dove into your website a few months ago, and I really thought it would be nice to have you on to help show people a little bit about something that myself and I think most of the population doesn't really pay attention to because we're busy living our lives. And I think you've brought awareness to a subject matter, this organ donation and organ harvesting. And it blew me away when I started diving into it to hear some of what was going on in this industry. So here we are. I'd love to dive in and hear how you got started and maybe a little bit of your background for those that have never even heard of you and heard of what you're speaking about.
Sure. You hit the nail on the head. The problem with this aspect of medicine, the organ donation industry, is the lack of transparency and the lack of fully informed consent. And that really is what drives me. I think medical paternalism should have been finished somewhere back in the 1950s or 1960s, but in the realm of organ transplant, it continues today. And so that's why I write, that's why I speak, that's why I'm so pleased to be speaking with you today and your audience to bring some of these facts to light. But honestly, I did not set out to do this. This was something that was sort of heavily forced upon my heart because of an experience I had back when I was a young anesthesiology resident physician in training. So I came in one night for night call and I reported for duty, and the doctor running the operating room schedule said, "Oh, Klessig, glad you're here. We want you to go up to ICU. There's a brain dead man up there, and we want you to bring him down and give him an anesthetic for his organ harvesting." And I just, I kind of took a gulp. I kind of remembered somewhere along the line, I must have heard a lecture about brain death, but, at that very moment, I did not have every fact at my fingertips. So I asked him, I said, "Brain death, huh? Is there anything different about this case that I need to know?" And he laughed and he rolled his eyes and he said, "Just be sure someone has actually declared him brain dead. You know how eager the transplant team can be." That wasn't what I wanted to hear, Ryan. That was a bit of a shock, but I thought, okay, I screwed up my courage and I went up to ICU and I found my patient, and he was a young man about my own age at that time, and he had been in a motorcycle accident and he had a severe traumatic head injury. And yes, the neurologist had gone through and checked all the boxes on the brain death exam and had declared him to be brain dead. So I went and looked at my patient, and he didn't look dead. I went into his room, and honestly, my first thought was how glad I was that he was alone in the room. If you've ever had surgery, the anesthesiologist comes and discusses how we're going to keep you safe, how we're going to keep you comfortable, and how we're going to make sure everything turns out well for you after your surgery. But, what would I have said to a family whose loved one wasn't coming back? So I didn't have to hurdle that barrier anyway, but I went to see my patient and he was warm. He had good pink skin tone. He had a normal blood pressure. He had an excellent heart rate. He was young and healthy. He had nearly 100% oxygen saturation in his blood. I listened to his heart. I listened to his lungs. He didn't look dead. Honestly, he looked like every other ICU patient I had cared for. And in fact, better than most. He wasn't on very much for medications, drips, or infusions. So I took these facts and I went back down to the operating room and I found the staff anesthesiologist who was going to be supervising me. And I presented the facts to him and he said, "Okay, Heidi, what's your anesthetic plan of care?" So, I was honestly so brainwashed at the time. I was being trained to think in a certain way. So I can't believe I said this, but this is what came out of my mouth. I said, "Well, I think I'll give him a paralyzing agent so he doesn't move during the surgery because, surgeons find it difficult to operate when patients are moving. And I'll give him some fentanyl as a potent painkiller to blunt any swings in heart rate or blood pressure that might damage the organs."
Mm.
So we said, "Okay, are you going to give him a drug to block consciousness?" I was stunned. I asked him, "Why would I do that? Isn't he dead?" And my attendings just looked at me, gave me a slow look over his operating room mask, and he said, "Why don't you give one just in case?" And he
Mm.
walked away. It is to my shame and regret I did what I was told. I brought the young man down. I gave him the anesthetic that we had proposed. And I'm here to tell you, he reacted to the incision, to the bone saws, to the organ removal, just like any other patient. He required the same types, the same amounts of anesthetic as anyone else. And Ryan, I told this story later to a friend of mine who's a pathologist, and she said to me, Heidi, when I take out organs during an autopsy in the morgue, I don't have to give any of those drugs. So this experience stuck with me, and it rankled. And
Yeah.
and as later in life, as I mulled it over and had time, I went and researched. Honestly, researching, trying to find a justification for what I had done. But in all honesty, all of the facts, all the studies, all the evidence pointed the other way. These people are not biologically dead, but through redefinition, they have been now legally and medically redefined as being dead.
That had to be pretty painful and hard on your heart, I'm sure, at the time. And what did it lead you to when you started doing this research? Did you continue working as an anesthesiologist and continue doing this over and over again, or where did it lead you from there?
Interestingly, I went out from my residency training into private practice, and I practiced 1 year of operating room anesthesia. And during that year, I never encountered another organ donation. And after that, a partner and I decided we missed talking to our patients, and so we went and we opened up a chronic pain clinic, which is a subspecialty of anesthesia. So I left the operating room after 1 year, and so I personally didn't have to brush up against this again in my own career. But
Mm.
yes, as you say, this experience continued to nag at me and bother me, and that's what drove me to do more investigation and ultimately write my book, The Brain Death Fallacy, and to have a website, respectforhumanlife.com, and to do speaking and podcasts, just because I feel at night I still have to think about this case, and I don't want other people to go through what I've had to go through, and that's why I try to give everyone the medical information they need so they can make an informed decision when the worst day of their life happens and they're struck with a tragedy like this.
Yeah. I've heard you speak to some of, I loved on your website how you showed who the survivors were, which was powerful. And I heard
Mhm.
some of their
Mhm.
stories, and I'd love to have you share some of that. But I also liked how you began some of your conversations with some of the issues in the centralized medical training models, where doctors are very good at regurgitating and memorization of large amounts of information, and they don't have that ability to question authority. So there's this authoritarian model built into it. And then you have an incentivization structure that's designed for huge amounts of profit, which is true for pharmaceutical elements of big pharma. And you look at what happened during COVID. And I think right now, because of the pandemic, a lot of people are starting to at least question their doctors, the medical authorities. Doctors are beginning to question their own training. And so I think there's a huge awakening happening at large, which is a good thing. Can you go into some of that? What happens with doctors and their training in the centralized model?
Yeah. It's interesting. If you think about the kid that you went to school with that became a doctor, it's the kid who, was smart and could gobble down all that information and spit it out correctly on the test, right? So doctors, in a way, are sort of groomed, selected, and trained. We apply to medical school on the basis of having that skill to take a large volume of information and to spit out the right answers on the test. We're not selected for being philosophers. We're not selected for being ethicists. We're selected for being good at playing please the teacher,
Mm.
if you want to put it very bluntly. And that can be good, because honestly, doctors and nurses too are responsible for vast amounts of information. And honestly, as you mentioned, it's not even possible for medical professionals to personally investigate everything that we are taught. We are forced to take most of it on authority. And I think that's sort of what's happened in some of the examples you named. Certainly with the brain death example, here I was, it was going to be the middle of the night, and I didn't have time to go and do quick research. I mean, everyone was waiting in that operating room for me to bring that patient down. There was time pressure. Everyone else was going along with it. So I fell victim to the fallacy of authority and the fallacy of the majority. And so I don't hold any animus for my colleagues who have been trained just like I was. It's not possible that they could have personally researched this. And that's why I did the work to try to make this information more available. But that's I think, being exposed, as you mentioned, with COVID, it was breathtaking to me how many doctors just went along with it, because that's what they're trained to do. They're used to putting their head down, checking the boxes, and doing the work. And that's what they know.
Yeah. It takes a lot of courage too to go against the hive. When you have groupthink and you get ostracized, or you get your reputation tarnished, or you even lose your medical license. And so people are afraid, even though they know what's right. And I really do love the people that have the courage to question authority and to stand up for what actually is true, no matter what it takes, even if it does involve risking losing your career or your reputation. I had to
Well,
do that with my.
I have to stop you, because I cannot take that praise, because the only reason I can do this is that I'm fully retired. I have a lot of colleagues who are still working, and they do risk their lives, not their lives, their jobs, their livelihoods, when they come out with these things. Whereas I have
Mm,
that freedom, being retired, to be able to speak freely.
yeah.
Go on.
Well,
I've
it's yeah.
interrupted you.
No, I
Sorry.
love that. It does take courage, though.
No.
And can we go into the history then? Let's start with how much is a human body worth in this industry, and then go back into maybe where some of the languaging got twisted and some of the definitions got changed.
Sure. The Milliman Actuarial Company comes out about every 5 years with a report on the dollars and cents of transplant in the US. And in 2025, the Milliman report showed that the transplant industry as a whole is over a 60 billion with a B dollar industry in the US. And I don't often talk about the dollars and cents, but my thinking on that was changed just recently when I talked to a woman whose family member, with a lot of pressure, she described a lot that the family was put on under a lot of pressure to give a loved one up to become an organ donor. And then she found out how much the body they gave away for free was worth. And so now I do speak about it a little bit more freely because of how much it meant to that woman. So on the Milliman report, you can add up the billable charges. And so if a person, is going to give their heart, their lungs, a liver, kidney, some intestine, a pancreas, and that doesn't even include, the tissues. I mean, people also are harvested for skin, bones, heart valves, corneas, all of other things. But just those organs I mentioned are worth over $8 million in billable charges. So again, it is a very lucrative industry, and I'm not casting aspersions on anyone saying they're just doing it for the money. I think most people in organ procurement are fairly zeal driven. They believe that they're doing good, taking organs from someone who's at the end of their life and giving them to someone else to promote and sustain that other life. But the dollars and cents don't. They don't not matter, I guess I would have to say. And so it's worth thinking about that and bringing that up.
Okay. Thank you. And then when we get into the definition changes and some of the issues when it comes to calling somebody brain dead, and if I was to go and check boxes to be an organ donator, I would have done that throughout most of my life because I trust the system and think I just want to help somebody with my body. It's no longer useful. So, can we go into some of where you started to discover these definitions being changed?
Sure. So for most of recorded history, people did not need a doctor to know if someone had died, right? People declared death at home, on the farm, on the battlefield. They would look at the person, and if there was an absence of breathing and an absence of a pulse, and over time those things were not able to be restored, that person was felt to be dead. And again, death ultimately is a bit of a more metaphysical uh, definition that I have to give you, because again, we're not just, I tell people I'm not a materialist. People are not just meat in motion. We have a immaterial, a spiritual aspect, a life force, a spirit, a soul that is in tight union with our material or physical body, and it's ultimately death is the departure of that immaterial part. But because we don't have a spiritometer, a soulometer, we don't have any device that can see the departure of an immaterial spirit, we do rely on the traditional signs throughout history: loss of breathing, loss of pulse, passage of time. And that's where our traditions of the wake, the vigil, the visitation come. People have time, and that's a necessary time for people to grieve and to come to terms with the fact that their loved one has passed on. But in 1968, 13 men at Harvard Medical School wrote a landmark article in the Journal of the American Medical Association called A Definition of Irreversible Coma. And interestingly, in that article, that they did not say that these people were actually dead in fact. They described these people as being desperately injured. And they said that these desperately injured people's lives were a burden to themselves and to others. And that if we would just redefine these people in a deep coma as being dead already, it would have the important utilitarian social benefits of freeing up ICU beds and removing the controversy over using these neurologically injured people as organ donors. So by the stroke of a pen, these doctors and lawyers, and there was even a theologian on the committee, said we should just redefine people in a deep coma as being dead already. They had no tests, they had no studies, they had no evidence. There's not a single scientific reference on their paper. But this idea, believe it or not, I would have thought people would have bucked back against it, but it was very readily accepted in 1968. Whereas in 1971, Roe versus Wade became instantly very controversial when people at the beginning of life were being redefined as not being worthy of life. People at the end of life, somehow that was not bucked back against in 1968, and it has continued to today.
Wow. And did the industry take off at that point where there was a lot more money, obviously, because of the changes in the definitions?
It was almost a media circus. If you look back at the newspaper and the magazine reports about Dr. Kristen Barnard and the first heart transplant in South Africa, I mean, he became just a media darling. He had starlets going out on dates with him, even though he was married. There are pictures of him with an old starlet named Gina Lola Brigida, and it was a very strange mindset at that time. And so there was this thought of medical progress, and we're breaking a new frontier. It's sort of sad to hear the story of those transplants that he did in South Africa. The first one that was a heart was taken from a young woman named Denise Darvall. She was in the ICU, her heart was beating, but they decided that she wasn't going to recover. They didn't have a brain death definition at the time. And they took her to the operating room. And later, Dr. Barnard's brother, Marius, admitted that they actually stopped Denise Darvall's heart with a shot of potassium. before
Wow.
taking it out and putting it in to the recipient who lived just a few weeks before dying of pneumonia. The second one that he did was on New Year's Day in 1968. It was a young black man who had a brain bleed while picnicking with his family and was brought into the hospital. And that very same day, the transplant team approached his doctor saying, "We want you to declare this man to be dead." And his doctor was quite concerned. I've never declared someone with a beating heart to be dead before. But he wrote later in the Journal of the American Medical Association about his struggle with that. But he said, "I was under a good bit of pressure from the transplant team, and I felt that my job was at stake." And so he,
Mm.
the next day, did declare that young man dead, and then they took that heart as well. So the whole enterprise has some very sketchy underpinnings. In 1971 through 72, the only prospective multi-center study of brain death was undertaken in the United States. They took over 200 people who had been declared brain dead. And honestly, back then, the standards doctors used were stricter than what people use today.
Mm.
They took over 250 brains to autopsy to see were these brains destroyed. And the answer was no. Less than half, 40%, showed diffuse signs of tissue destruction. 10 looked actually normal. And
Mm.
so the principal investigator, Dr. Gaetano Molinari, on this study wrote that brain death is a prognosis of death, not a diagnosis that death has in fact occurred. And that's an important thing, I think, for people to keep in mind as they think about this. From the beginning, from the 1968 redefinition to the first and only prospective multi-center study, and continuing today, brain death is a prognosis of possible death, not death itself. And that's how I get to have a survivors page on our website, because people have survived this diagnosis.
Yeah. And I don't think most people like myself realize that the body has to be pretty much alive to get an organ transplant. So you have to keep these people alive. Otherwise, the organs deteriorate or die really quickly. Isn't that right?
Yes, that's an important point. So organs, things like heart, lungs, livers, kidneys, these sorts of things, very quickly in the absence of circulation begin to decompose and become unsuitable for transplant, as opposed to tissues. And again, tissues would be things like skin, bone, heart valves, corneas. Tissues are much more simple structures, and they are more resilient to the absence of blood flow. So you actually can donate tissues from a biologically dead body, unlike organs, which have to come within the time frame, either with brain death that the person is still biologically alive, or with the new way that they're taking organs. They call it circulatory death, in which they wait for someone's heart to stop beating for just 2 to 5 minutes before procuring organs. But it's well documented. People are every day resuscitated within 2 to 5 minutes of their heart stopping. And if you could still be resuscitated, you were never dead. So again, this
Wow.
category also represents a vulnerable section of people who are having their organs removed when they could still be resuscitated, and thus they're not known to be dead.
Yeah. Yeah, and I know that you've spoken about the beauty of organ donation. Like I have a friend who's got a new kidney because a friend of his gave him that kidney and they're both still
Mhm.
living, and that's
Mhm.
amazing, and what a cool thing to have that technology and that advancement to be able to do that. But this has gotten really weird now when you think that someone's dead, and you went into some of the survivor stories on your website. I'd love for you to speak to that a little bit.
Sure. Yeah, just to emphasize what you said, I am not against transplant. I'm just against unethical transplant. Living donation, as you said, when both the donor and recipient remain alive after the procedure, this is a wonderful, ethical, altruistic thing that you can do for someone in need, right? I have a friend too who gave a kidney to her daughter, and her daughter's lived for over 20 years. This is
Mm.
not universally condemning transplant whatsoever. I think we need to find more ways to help people with organ failure, and promoting wonderful things like living donation is one of those ways. But as to the survivors, I have the privilege of actually having spoken with one of them. Her name is Jennifer Haman. She was a young woman, and her doctor unfortunately gave her a medication for an infection that was contraindicated because she was already on a epilepsy medicine to prevent seizures. And that combination threw Jenny into intractable seizures, so much so that her brain simply shut down. And so she tells the story very movingly. She said she can remember lying in the ICU on a ventilator, and her eyes were closed, but she could hear everything. And that's an important point too. I'd like to emphasize, if you go to visit someone in the hospital and their eyes are closed, remember their ears are always open. Never
Mm.
say anything in that room that you wouldn't want the person to hear, because odds are they really could be listening, as Jenny was. And she said she heard the medical team shuffle into her room, and she heard her doctor say, "This is a sad case, a young woman with two small children at home, and other than her dead brain, she's an excellent specimen. So many people could be helped by her organs. But her husband is being completely unreasonable and won't make her a donor."
Wow.
And Jenny said it was so horrible to be in that state. She said I could hear everything, but it was as if my brain, I couldn't find the connections to move, to speak, to take a breath. It was as though I'd lost the ability to do that on my own. And there's actually a medical condition. It's called cognitive motor dissociation, which now is well described, in which patients are that locked in sort of state. They can hear and understand, but they can't communicate.
Yeah.
Jenny actually attributes her recovery to a devoted nurse. That nurse never gave up on her, unlike the rest of her medical team, and said, "Jenny, I know you're in there. You need to try to take a breath. I know you can do it." And Jenny said, "I was just trying and trying, and then suddenly something clicked." And I went,
Wow.
and took that first breath. And Jenny went on to make a full recovery. And
Wow.
not only did she go back to being a wife and mother, she went back to school and became a nurse herself, so as to give other patients better and more compassionate care than what she achieved. So again,
Wow.
people can recover. Now, are they all going to recover? Of course not. I mean, some of these people are desperately ill. But I mean, why? If I'm in the hospital, Ryan, I would hope that my care team is working to protect and preserve my life. I'm not excited about people coming around thinking that I'd be better off dead.
Yeah. Yeah, and I really don't feel like, even in my field as a paramedic, we're never really talking about how we discuss or how we are in the field of people that are unconscious, or at least not speaking or with their eyes closed. We have people in the back of ambulances, and people are sitting here in the back bantering, acting like this person could be dead, or we're working a code and there's, you know, I've been a part of it myself where you're joking or whatever, but I don't think I've talked to some incredible people on this podcast about the nature of consciousness, neuroscientists, people like this, that they at the end of the day don't understand what anesthesia is. We don't even know what's really happening and what consciousness actually is. So we jump to this behavioral shift without even understanding at the root core, what is consciousness? We don't know. So when people are somewhat shut down, like this girl you're describing, it's really sad. It's almost like those nightmares you've had. Anyone's probably had the one where you just can't move or do what you want to do in the dream. It probably feels very similar to that.
Yeah, you're right. No, that's absolutely true. And it's difficult, because, being a paramedic, you are going through difficult emotional circumstances, and a certain amount of levity sometimes relieves the pressure. I can understand that, but it's important to keep bringing ourselves back to remember, there's perhaps a third person in the room, so we have to treat that person as if they can hear us.
Yeah. And I see with this changing of definitions, I'd like to hear a little bit about how there's been some battles to change and shift definitions and throughout your discovery and as you've been pushing for it. And it almost seems like it's going in the wrong direction from what I'm gathering. And it seems to me like when you look at what happens in China, how bad it can actually get when you have incentivization structures driving things and changing of narrative and the ability to control narrative. Like, I really don't think the general public knows anything about what we're discussing.
Yeah. Well, nobody likes to think about death, right? So it's a discussion that we try to put off because it's frightening. It's an uncomfortable discussion to have. So I do try to encourage people, now is the time to look at these things because again, if you're on the worst day of your life, you haven't eaten, you haven't slept, you're looking at, maybe your child laying there on a ventilator, you're not going to be in a good position to make a good decision. So now is the time to look at it. And bringing China up is very important because, in China, the respect for human life is really lacking, especially as pertains to political prisoners. And so, initially, with the practitioners of Falun Gong being an undesirable populace, those people have been arrested, they've been submitted to organ and tissue typing, and they have been put on the market as organ donors for transplant tourists who then come and that organ donor is executed via organ harvesting on the day that all the transplant tourists shown up. And now it's the Uyghur Muslim and the house church Christian and any other politically undesirable person is at risk of having this happen to them. So that's a huge problem. And in America right now, it is still legal in most states for insurance companies to pay for those procedures in China, which a handful of countries have made it illegal, but as a whole, America has not.
Can you tell people where they could discover some of this information? Because I did have a professor on, I forget what her field was at this point because it was so long ago, but she was from China. And I
Mm-hmm.
brought this up because she basically called Falun Gong a cult and dismissed it pretty quickly and said that that's not true and it was propaganda. But I also know that in China, it's hard to get, just like it is here now. There's such narrative control and so much censorship. I've even had so many shows of my own pulled so that people can't hear certain conversations. But where could people go to discover some of these harsh truths?
Yeah, this is not fiction. This is well documented. David Madison, David Kilgore, the ambassador from Canada and a human rights lawyer from Canada to China, have written books about this. You can go to my website, respectforhumanlife.com, and go to the button that says forced organ harvesting, and you can find more. There's videos, there's documentaries, there's links. The other organization that I work closely with is called Doctors Against Forced Organ Harvesting, DAHFO, or something like that. I don't know if I got the letters right. Doctors Against Forced Organ Harvesting. And they have done the lion's share of work in this area to bring the light of truth to something that is very dark.
Yeah, I even go to the Shenyang performances, and it's all about raising awareness for what's happening there. I have heard of the Uyghurs before, but it's hard to find some of this information. So I appreciate you sharing those sites and some of that because
Mhm.
it's in this day and age, we're bombarded with information and people hear the most outrageous things. And you're like, it couldn't possibly be true that Epstein Island is real or that we have bioweapons labs or you name it. There's a million things you could look at and go, are we really that off course as humans? And it's like, well, in order to get to a better version of ourselves in the future, we have to take on the shadow side and we have to be willing to grieve and to feel and to look at the truth. And it's ugly. And I'm one to try to get people on to share these truths like yourself, and it's just harsh. And I know, like you said, people don't want to talk about death or about the dark stuff, but this is the time because it's getting exponentially weirder and worse. And I think right now there's also the weapons of mass distraction. And I think that's what's being used right now to keep people sort of dopamine driven. And they like the quick dopamine hits and they like to use algorithms to keep people addicted to screens and to
Mhm.
memes, but they're not being driven to see the harsher, truthful stuff that's, you
Mhm.
know, crimes against humanity. And the people that are speaking up are being censored, and so it's so powerful right now. And I really do think it's important for people to go to your website, take a little gander at it, and just be activated. I've heard you speak about the emotional challenges when people hear these things, and you're saying that's when you know you're successful, because if you're not feeling the emotion of it, then you haven't really made your point.
Yeah. No, I'm very compassionate to people because, again, people have bought into what they thought was a trustworthy idea, and it's hard and harsh to find out that you've been betrayed. So I tell people, doctors and nurses, as we mentioned earlier, it's not possible for you to have personally researched everything that you need to know. I mean, you were told this, you acted in good faith based on what you thought was right. Same thing for people who have given a beloved family member to become an organ donor. It is in no way your fault that you were lied to, that you were not given all these facts. And I tell people who have received an organ, we are glad that you're here. We are respectful of your life as well. Again, it is not your fault that you were given an organ that perhaps was procured in a way that might violate your conscience. Go on and live the gift of life you've been given to the fullest. But it's important that we speak the truth in love to one another, and being able to share the truth is so important. And I don't want to see, again, I don't want to see this shut down. There was an article written by a collection of doctors and philosophers saying that we should just shut down the discussion on the questionable ethics in organ donations for fear of starting a culture war. That's just a fancy way of saying shut up. Keep
Yeah.
quiet. Don't tell people what's going on. We know what's good for those people. Don't tell them the truth. And I find that offensive. I find that demeaning. I think everybody has the right to be given true, transparent, full, correct information before they make a decision.
Yeah. And what is the biggest pushback you're getting, or the biggest hurdles right now that you can see as you're going forward with this?
The American Academy of Neurology is very invested in pushing their brain death guideline. And that's a huge private medical organization with a lot of clout. So their brain death guideline was recently revised in 2023, and now it explicitly says that brain death can be declared in the presence of ongoing brain function. Now, this is a problem because the Uniform Determination of Death Act, which is the foundation of brain death laws in the majority of states, states that brain death must be the irreversible cessation of all functions of the entire brain, including the brain stem. So back in 2015, there was a unfortunate young woman named Aiden Halou in Nevada. She went in for a routine appendectomy and never woke up. Her father was told what happened to her was a medical mystery. They couldn't tell her father why his daughter was brain damaged after what should have been a routine procedure in a young co-ed. But her father didn't believe that his daughter was dead and got custody of her and took her case all the way to the Nevada Supreme Court. And in a unanimous ruling, the Nevada Supreme Court ruled that the American Academy of Neurology brain death guideline did not appear to adhere to the law under the Uniform Determination of Death Act. So subsequent to that, the American Academy of Neurology went to a body called the Uniform Law Commission, and that's a body of judges and lawyers that works on making laws uniform across the United States. And they asked them to revise the definitions of death under the UDDA, to broaden them, to make it so that the American Academy of Neurology brain death guideline would fulfill the requirements of the law. So I was an observer to the Uniform Law Commission as they met over several years and discussed these things. And they could not come to a consensus even within the study committee. And then when the committee brought their findings to the national meeting in Hawaii of the Uniform Law Commission, the lawyers listened and they said, why are we changing the law to accommodate doctors who aren't following it? Why don't we just ask doctors to follow the law? And it went nowhere. And so the Uniform Law Commission actually tabled their work on revising the UDDA to broaden the definition of death in September of 2023. 3 weeks later, the American Academy of Neurology brings out their new brain death guidelines saying you can be declared dead with the ongoing function of a part of the brain called the hypothalamus. And, the hypothalamus is an important part of the brain. It's useful. It keeps us at a warm body temperature. It regulates our sodium balance and thus our blood pressure. It's necessary for sex drive. It's necessary for awareness, and it's necessary for pain detection. It's a big part of your brain, but according to the guideline, you can be declared dead while that part of your brain is still working. So now the AAN is going to state by state medical boards and societies as a way to sort of get around the UDDA, asking state medical boards and societies to install their brain death guideline as the medical standard of care. So that way they can maybe get around the law. And the AAN just this last month came out with an additional statement of guidance on brain death, saying that, if a family objects to the brain death diagnosis and, by gentle, coercion, instruction, putting pressure on the family, if you can't get them to change their mind, they authorize that doctors should go ahead and unilaterally withdraw care above the objections of the family.
Wow.
So again, there's a lot of pressure for this, and it's very disheartening
Jeez.
to me. And people just don't know. And again, this is a private medical organization. I mean, what we should have more of a democratic process before we change the way people are declared to be living or dead.
Can you give an example? I think I heard you speak about a particular case where the family objected and the doctors withdrew care on a patient. And then a couple other examples I've heard where people went on to live these really happy lives that were at one point considered to be dead, and they were going to go through with the process.
Yeah. So Terrence Howard was a young man a couple of years ago. He was a college athlete. I believe he played in a Rose Bowl. He was a football player. And he was in a minor traffic accident. He actually, because he was a sweet kid, he got out of the car to check on the people in the other vehicle to be sure they were okay. And a third vehicle came and ran him over. And he was taken to the hospital and he was declared brain dead. And his family was like, no, 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 no. Our son is warm. He's got a heartbeat. He's got a blood pressure. We'd like to have him transferred. And their requests were not only refused, but they were mocked. The family said this and put on social media, and they had video of doctors and nurses in the hall laughing and joking as the family begged that their son could receive care and were denied. And it's heartbreaking. Also, the case of Amber Ebanks in New York State was very tragic. Amber went in for a routine embolization of what's called a AVM, or arteriovenous malformation in her brain, a tangle of arteries and veins that can potentially bleed. And the procedure went terribly wrong, unfortunately. And no medical procedure is without risk. But Amber was then declared brain dead. But her family were all living in Jamaica and couldn't get visas or whatever they needed, passports, to come see Amber. So they wanted Amber transferred again. But the hospital said, nope, she's dead. We're not going to feed her. We're not going to wash her. So Amber sat there while the family tried to work through the New York court system, being starved to death. It got to the point where vermin were starting to grow in her wounds and her hair because the hospital wouldn't give her the simple dignity of being washed.
It's horrible.
And she eventually starved to death. I mean, these are ghastly things happening in American hospitals when families simply disagree.
God, it's horrible. And it's really sad because of all the people partaking in the system where they think they're doing something good by obeying, all of their protocols, if you want to call them that. And we all then partake and do things that are not ethical because we're just unwilling to maybe question authority again. So what can people do with this information? So people listening, what do you think the best starting point is on the practical level?
Again, just start by being willing to rethink something you always thought you knew the answer to, and that's where the process starts. And again, with the website, respectforhumanlife.com is a good place to start. I've done a short video series, 5 to 10 minute videos that are easy to and quick to watch on topics such as the brain death, donation after circulatory death, this new ghastly procedure called NRP donation, in which they play fast and loose with the definitions of death under the law. Do you want me to tell you
Jeez.
about that one?
Yeah,
I didn't
please.
think it could get darker, but it can. So, again, under the law, there are two ways to be declared dead. One is the traditional heart and lung stoppage. The other is the irreversible cessation of all functions of the entire brain, including the brainstem that we mentioned earlier. So in this procedure called normothermic regional perfusion, or NRP for short, they take someone who is not brain dead, but is not expected to survive. They give them a do not resuscitate order so that while resuscitation could take place, it is not going to.
Wow.
They bring them to the operating room and remove their support. They wait for the heart to stop. After the heart stops, they give you a 2 to 5 minute standoff period, depending on where you live, which is sort of interesting. And you're dead or alive based on your geography, basically. And then once your heart stops, in the NRP procedure, they want to procure that heart, but the heart is, so reliant on good oxygenation that they don't dare let it sit very long without oxygen. For even the time to now open the chest and remove it might be too long. So what they do, they begin this procedure by clamping off the circulation to the brain, making the patient brain dead on purpose, and then using an ECMO or a cardiac bypass machine, they do a complete resuscitation on the organs, including the heart, so that the heart starts beating again in the patient's own chest. So, Ryan, how dead are you if doctors can get your heart to start beating again in your own chest? Well, no, that you're obviously we're not. I mean, first they declared you dead under the irreversible cessation of heart and lung function. But then because because obviously your heart wasn't irreversibly stopped and they were going to start it again, they had to clamp
Jeez.
off circulation to your brain. So now that you're brain dead on purpose, now you're dead under the second definition of death under the UDDA. So they can restart your heart, make sure it's beating well enough to take it out and put it into someone else's chest.
Jeez.
These things are egregious. And if people knew that was what was going on behind the operating room doors, I think they would object. But again, this is the lack of transparency. These people, this is happening in the US right now, but no one is being told.
It's horrible to hear these stories. And then it's just sad, too, that we've thought of the human being as a materialist reductionist model of just meat, flesh. And then
Mhm.
it's just, oh, it's just the heart beating because you don't have maybe conscious awareness. But it's such a strange thing. I really think it's just people don't know anything about it. I sure didn't, to be honest. I used to check off that box. And what can people do to take their donation back, their box check back? Because I've even heard that it'll still happen at some places.
Yeah, it's very difficult. I On our website, if you go scroll down the home page, you'll find a button that says "How do I get off the donor list?" and that shows you how you can do that. In your state by state, you should go to the Department of Motor Vehicles, and for a minimal charge, like $15, you can have that removed. But there's also a national registry that you should unsubscribe from that as well. But the U.S. House Ways and Means Committee just published an investigation they're opening up into a New Jersey organ procurement company. These people were going into hospital rooms and talking to family members. And even if the person had removed their designation from their driver's license, this organ procurement company was saying, "Oh no, he's still a donor. We get to take the body," which again shows the lengths to which these people are zealous to get those organs and get those bodies out from under. I mean, organ procurement companies have successfully sued in court to harvest organs over family objections. So what people need to understand, if you have registered as an organ donor, that is considered legally binding, even though you signed it without any type of informed consent. So you
Mm.
should do what you can to remove that. Also, we have links to our sister organization, the Halo organization, and they have put out a very nice, I'm going to hold it up one way, and then if it's upside down for you, I'll hold it up the other, a nice card. And on this card, it talks about, how you are not an organ donor, and you can put that in your wallet. They also have a very nice life-affirming healthcare power of attorney document. So you can fill that out saying that you want your life protected and preserved, not to be thought of as a source of spare parts, right? So there are good resources out there. But the most important thing, again, is talk to your family, to have the people around you, your healthcare surrogate, your friends, your family, know what your wishes are and advocate for you when you're in the hospital.
Wow, I appreciate all of the work you're doing out there to make it simple for people too, because a lot of times people don't know where to begin.
Mhm.
If you were going to die today and this was the last day on earth, what would you want to share with people, with the world?
Again, we need to speak the truth in love to one another. We need to value people for their humanity, regardless of their abilities. These redefinitions of disabled people as being as good as dead have to stop. And so, again, I would encourage people to rethink the things that you thought you knew and get the information so as to be a protector and a preserver of life.
Wow. Well, thank you so much for your time today, and I really do appreciate the work you're doing in the world.
Thank you for helping me get the message out.
Yeah. Thank you for listening to the episode. If you enjoyed the episode, please rate the show. That helps people to discover it, and enjoy the next episode.
What we call reality is in fact nothing more than a culturally sanctioned and linguistically reinforced hallucination.